while I've known you for a few years now, this is the first time that we actually engage in this capacity. So
It
we're
is.
excited to spend some time chatting to you about one of our both mutual favorite topics, Krys.
Finally.
And particularly, diving a little bit into what the journey has been like for Krys and what it has been like for you personally, also becoming a leader of this now pan-European successful company. So maybe just to kick things off, also for the benefit of everyone who's listening in today, could you share a little bit about what Krys, or Livi as you're known outside of Sweden, is, and why does the European healthcare system need Krys?
So what do we? Yeah, we can talk about that. So we are a health technology company, and we're starting now to operate at scale in 5 key geographies in Europe. We're technology at core, but we also operate healthcare ourselves. And as Finn said, we're now the largest company in our space in Europe, covering more than 100 million lives across Europe. On the technology side, it's 2 sides of it. So we have a patient-facing side where you could receive and manage your health, instantly talk to doctors, nurses, psychologists. You can receive prescriptions, referrals, etc. And on the clinician side, we have built great tools for clinicians out across Europe to deliver high quality care digitally, now also partly physically, with high capacity and high medical outcomes. So yeah, that's what we do, and trying to solve one of the main problems out there, healthcare. It is. I obviously have been thinking about this day and night for the latest 7 years, but my background is that I'm a patient myself and had my fair share of healthcare. And as many others, I've been fairly frustrated on how bad part of the system is structured. We're spoiled in Europe with great medical talent, but there's still a lot of awful room for improvement. And that's the path we're on, trying to build a stronger and better healthcare system and give more Europeans quicker and better access to care.
Yeah, I mean, I love that mission. As a patient and user of Krys myself, it has definitely been a breath of fresh air to be able to access primary care so conveniently and so quickly. And when you and I have talked about Krys in the past, you've often mentioned that change needs to be patient driven, and Krys is very patient centric and patient first.
Mm-hmm. Yeah.
Can you expand on this a little bit? What needs to happen for us to get there?
Yeah, no, we are. It's a shame that that's actually a unique thing. I think that all healthcare organizations should always have the patient and consumer of healthcare as sort of the first customer, but that's actually the honest answer is that that's not always the case, and that's always how we have been thinking about things. Let's try to solve it for the end consumer. Let's try to solve it for the patients. With that said, you then obviously also have to solve for the clinician side, and you have to solve for the payers of healthcare. Our ambition since we started have always been to be a mass market solution, to be something for everyone. And in order to achieve that in Europe, you obviously also have to address the very large payers of care. And that's our main partner is the public system. So you obviously need to make sure that you solve for all our key stakeholders, not only the patients, but yeah, I think, still a lot of what we do is still driven by my own frustration on how bad part of it is actually is. But I think it's highly rewarding. It's also like, if you look into the healthcare industry in general, if you look into the US system, it's beyond broken, but also the European system is fairly broken. And you spend 10-11% of GDP on healthcare, and yet it can take you days or weeks to see a general practitioner. It doesn't really make any sense. And it's not really a funding issue. It's not really a capacity issue either, even though it's, you do have areas that are underserved, and in some cases we are in need of more clinicians, but it's an efficiency and structural problem that you could actually solve a lot of it by innovation and technology.
Yeah, I mean, you kind of alluded to what was going to be my next question, which was, as you said, this is a huge market, but it's broken in many ways. But what would you say is the key pain point that you're trying to solve for?
Yeah, we very much started out of the access problem. I think that, and this varies between the different markets in Europe, but a lot of the markets in Europe, there is an access problem. So it's tricky to get into the system, and it's also a lot of inequalities when it comes to access, right? I think in France they refer to it as medical deserts. I think it's a good term, that you have like big areas where you have no or very limited access to care, and that's the case across the globe and across Europe. That there's a lot of inequalities when it comes to access of care, and obviously with the digital layer and a digital first offering, you could equalize access to care. So we very much started out of the access problem, making it easier for people to access care. Now we're starting to have a very wide range of tools. Also, you manage your health over time. You have treatment plans. Like we're starting to go into physical care as well. We sort of lock it all together by linking in specialist care and hospital care, etc. But that's where the starting point, solving the access problem, and then obviously we're tapping in some really big trends where patients are starting to take more control of their own health, and also more longer term, I think we can play a crucial role in also pushing the whole system into being way more preventative and proactive, because that's how a healthcare system should be structured, really. But I think access plays a key part of that. If you can't really access the systems, but that's the tough start. So that's where the starting point is, solving the access problem in care. And in order to do that, then you obviously have to solve other things as well, sort of the efficiency problems, etc.
Yeah. And I mean, you touched on some of the other tailwinds that are going on, which I imagine are helpful for Livi and for Krys. But I imagine 2020 was also quite a pivotal year, perhaps in many ways, in light of the fact that many consumer behaviors were forced to shift in light of the pandemic. How was 2020 for you, and how do you think that has affected the way that we should think about healthcare going forward, and Livi's place in healthcare?
Yeah, it's obviously been a big year for us, and we said we're obviously on the right side of a global pandemic, and we said to ourselves early on that let's do everything we possibly can to be as helpful as possible. And we have been doing a lot of things. We have been shipping free versions of our tools. We have been taking a deep responsibility on sort of home monitoring for people that tested positive. In some markets, we take a deep responsibility in helping create infrastructure for testing and vaccinations, etc. So, and we have hired an awful lot of great talent during the latest 18 months. So it's been a big year. And then obviously I think one thing that have happened is that it very efficiently have sort of anchored what we do across the globe. I think even before the pandemic, we were still in discussions about the core concept of digital healthcare. Can you actually do this? Like, can you replace a physical visit with a digital visit? Is it real healthcare? Can it be done or not? Like that debate is past. That's everyone now understands that what we do is a crucial and well-needed part of any healthcare system moving forward, and that was not always the case a long time ago. And I think we also see a change. And I think from a patient side, I would argue that patients have been very ready for this for quite some time. But from a system perspective and from the supply side and the clinician side, I think part of this, the clinicians have been fairly conservative. We see a shift there also now where clinicians also are starting to be more open to try new ways of working, and that have happened out of necessity. And many of them in some markets have moved to very basic tools, but they also realize that you can actually do quite a lot of things. And obviously a digital healthcare offering will not fully replace physical, right? And not in the short term, but it's an awful lot of things that you can actually solve with, say, medical quality and outcomes. And that is now very well anchored. But then I think on the regulatory side, a lot of the trends started long before the pandemic. A lot of the regulatory blockers that were there when you and Index first invested 6 years ago were already removed before the pandemic. But I would say it served us and the industry well in terms of anchoring what we do, that it is a valid and much needed part of any healthcare infrastructure.
Yeah. No, it's excited to continue to follow the changes that are undergoing in the different markets that you're operating in, and that leads me to another thought I had, because it's quite special in the sense that Livi is operating in a highly regulated market, and from an investor side, we're seeing more and more that investments are being made in industries that perhaps previously would have been considered too hard to crack from a regulatory perspective, whether that's finance or whether it's healthcare. You're now present in several markets in Europe. What have been the unique challenges that you faced when thinking about building a business in a highly regulated environment?
But that is obviously a challenge. And if you look back before we even started the company, we had a discussion a lot, like, why on earth haven't someone built this already? Because the core concept of what we're doing, be able to see a doctor, a nurse, a psychologist digitally, it's a makes a lot of sense. I can basically do anything else. I can buy a house, I can buy groceries, I can do anything on my phone, but healthcare was excluded. And I think part of that is because it is highly regulated and very complex in many ways, and we have never really shied away from that complexity. I think that is obviously a challenge, that we are operating in Europe with very different payer infrastructures between the different markets, also different sort of payer infrastructures within the market. Healthcare by nature or by tradition is very local, although digital healthcare is not local at all. Like we could obviously in theory we could scale what we're doing to any market, but you have regulatory hurdles. So I think your question there, what was the main challenge with operating in a regulated environment? Was that the question? I think if that was the question, the main challenge is that it is highly regulated and it's a lot of work. That's just no way around it. Like you have to roll up your sleeves and you have to go deep and you really have to understand the specific pain points of each market. But it's not unsolvable. But it's, as I said, we have never really shied away from that complexity, and that put us in the position we are right now. And I think it's getting easier and easier also because ourselves and others are not only opening the door for ourselves but also for others. And the largest industries out there they are all regulated industries.
Yeah.
So I think it's, if you really want to make something important and sort of make a big impact, like you can't really sort of not do something that is not regulated. If you look into healthcare, education, it's regulated, and there's no way around sort of partnering up with public systems. Really, like you could obviously do. When we initially launched in Sweden, we were a private service outside of the public systems, and we were a long time we were subsidizing it ourselves just to show that it's a valid service and people use it and it creates value. But yeah, it's just roll up your sleeves and do it.
Yeah. Curious, is it one of those things that more and more when we're thinking about talent and hiring, remote is becoming more of a trend, and also with the pandemic, in many ways it has become a condition that working remotely is necessary. When you're trying to enforce change that also requires regulatory changes, from a hiring perspective, do you need a lot of local presence? How are you thinking around remote in that context?
Yeah, so we have very strong local teams in sort of the key markets where we operate. We do have strong leadership in all of those markets. So it's when we think about market expansion, it's not really sort of a light touch thing. It is like we go very deep in the different markets that we are addressing. So then we obviously need to have strong local talent, and we recruit locally. Although we are now fully remote, and we have been since the pandemic started, and we will continue to. We believe that great people can work from anywhere. But when you think about the different European markets, we definitely need key expertise that really understands the British system and the French system. And the core of what we do is very similar, obviously, across the different markets. Like the technology itself is very similar, although it's local tweaks. But how you address the different partners that you need in different markets, that is a market exercise. And then we need strong people, and we have extremely strong people across Europe.
Interesting. You mentioned you've all been working remote, which is, as we chatted about, a big theme. How are you thinking about remote as you continue to scale, and will you continue to approach it in a similar way, being open-minded to that? Just what's been your philosophy with hiring more broadly and talents?
Yeah, so we are hiring across Europe, and as said, we don't. We will still run out. We have great offices and 5 European markets, and we continue to run our offices. But like, why would you force our employees to go an office. And also the core of what we do is a remote service, right? So it doesn't really make any sense. I think then, personally, I love to be in an office. I get a lot of energy being around people, but no, we will continue to hire, across the globe. Yeah. I think I think that the pandemic have shown the world that, you can actually, just as it have shown the world that the digital healthcare is a real thing, it's also shown the world that, remote work is actually, something that you can pull off.
Yeah, no, and it's absolutely, and it's exciting to see how much change you're making remotely and in all the markets that you're active in. Maybe switching gears just slightly, going back to, Finn mentioned you recently raised a large round, been valued at $2 billion, and as investors in your business, we feel very fortunate to be partnering with you, and it's been really exciting to see how the business has scaled since we first partnered with you. When you think back, over the past few years, in retrospect, would you say there have been any key inflection points that have really been pivotal to the organization and helped take the business to the next level?
To our organization, well, it's a good question. I think, as mentioned, our ambition have always been to make sure that as many people as possible can access the services. And when we initially started, there were no reimbursement infrastructure for any digital healthcare in any of the European markets, really, and that have obviously changed since then. So that is a rather big thing for us, given that we now can address more people. But I think it's as with most businesses, it's never really one silver bullet. It's a lot of small tweaks, and it's a lot of people in combination that sort of running in the same direction together, and then you solve things together. So I think it's tricky to sort of point to one pivotal moment in the business. In one way, you could maybe argue that the pandemic was, but I wouldn't really agree on that, because it's a lot of the changes happened already before the pandemic. Yeah, but no. What do you think? You're also involved in the companies. Do you think there's a pivotal moment where you can point to?
Well, I mean, as you say, it's hard to pinpoint maybe one.
I don't think it's maybe it is in some cases, but for us, it's never been sort of one single thing, really. It's been a lot of small, continuously solving a lot of problems, and then sort of.
Yeah. No, I mean, what I was maybe going to say was just having sort of looked at it from a more outside in perspective, not being an operator in the business. I think it was fascinating to see you go from Sweden, your main market, where you had one business model in place, and you had patients and a product that was well loved, and it was a delightful experience for consumers, and then quite quickly went into different markets, and how you adapted depending on the structure that was necessary in those markets, and how the business evolved from being just a Swedish-centric business to being also a pan-European one. And from what I recall, it was quite fast when that transition happened, and you were active in.
Yeah. No, that's true. We have covered a lot of the European markets for a long time, and then we just now made a decision. This is the right time to start to move into the UK and France, and it's for any company it's a big thing, but I think in our industry it's actually a rather big thing. But our ambition have never been to be a Nordic company, really. Like, we obviously, in one way we are, since we're headquartered here. I'm Swedish, but our ambition have always been to be a European company, and then just have to figure out when the right timing is to act. And now we're starting to have really strong presence and many of the key geographies in Europe. Then we are, even though we are $2 billion company, and we are obviously operating a slightly larger business and company now versus just a few years ago, we're still very much just getting started. It's just, I think that's also one of the really exciting things with the industry in general. Obviously, you're solving a big and a real need, but it's also no upper limit, really. Like, it will constantly be things that are left to be solved, and we are still serving sort of a subset of the European population. There's a lot of Europeans out there that we are not yet helping, and that's
Yeah.
So a lot of things for us still to be done.
And so just sort of, relaying that back to you, as you said, you're just at the early stages still.
Mm.
What is the overall North Star mission, and when will you be satisfied with what you've achieved with Livi?
Yeah. Well, it's a tricky question because in one way, yeah, I think we should be proud of what we've done so far. But as said, I very much feel like this is, we're still just starting to scratch the surface. I don't think it will ever be a point in time where you feel like, wow, now we have solved all of it. I don't think that will never happen, right? Because there will constantly be, things that you can improve, and it's also sort of in the DNA of the company that we're always thinking about how can we do more, how can we be better, and I think that we should obviously keep that as long as we possibly can. And it's an industry and it's a space that also will allow that, because from an outside perspective, you actually do realize that healthcare is a bit broken, and then when you start to dig into it, you also realize that it's more broken than you first thought it was. And that means that it's an awful lot of room for improvement, and those improvements will lead to way more people across the globe having living healthier and better lives. And so, I don't think that there will be any point in time where we feel like, oh, now we're done. I don't think so.
Hmm. Hmm. And when you think back, clearly you have a big ambition ahead, and we can't wait to see where Livi will be just 5 years out, and then 10 years out, and even further out. But when you think back, as you said, you're proud of what you've done, and you should be. What have been your biggest learnings as a leader, and as the CEO of the company over the past few years?
And the biggest learnings, well, I think my role have obviously changed a lot since it's a big difference being a CEO of a 4 people startup versus, I don't even know how many we are right now. We're probably including clinicians, we're 2,000, 3,000 or something like that. So obviously you you have to learn a lot. But I think in the end, what sort of makes a great company, it's always, if you sort of boil it down to its core, it's about the people who are working with you. Like then obviously we have a lot of great products that we build, a lot of great partnerships and learnings. But at core, what is the core of any company? It's the people.
Yeah. No, it's something that we definitely agree with you. We always talk about how, when we invest because it's the person, and it's a relationship, and it's the people that are behind. So I absolutely agree with what you just said. Maybe wrapping off our session with something a little bit closer to home. We've chatted about the Krys journey, and
maybe we should explain that, because we're referring it because we do run with 2 different names, given that Krys is more or less impossible to pronounce. Like, now you are Swedish, so you can actually pronounce it, but that's the reason why we go with 2 names. It's that it's hard to pronounce, but Krys in Swedish is a saying for being healthy. So it's a very strong name here, but it's tricky to pronounce it in some markets. So that's why we go with Livi as well.
Exactly. I just default to Krys, but yes, you're right. Outside of Sweden, you're known as Livi. But yeah, maybe just sort of bringing it back a little bit closer to home. As you mentioned, you started out in Sweden. You're a very successful Nordic company, and today also a pan-European business. What unique advantage would you say founders have starting in Stockholm and in the Nordics? It's been the hub of other successful companies like Spotify. What do you think there is about the fertile ground in Nordics that makes it advantageous to start there?
Well, I think right now, if you compare it to, how old am I? I've been in this industry for 13 years. If you compare Stockholm and Sweden in general now versus then, it's obviously a huge change, because there is a functional ecosystem. It's you do have access to a lot of talent that have actually gone through a few journeys before. If you look into our leadership team, more or less everyone have been building big companies before, and you have access to that kind of talent locally. So that, and you didn't really have that Europe 10 years ago, and so it is a strong hub. It's starting to be a very strong hub, and you have a few very successful full companies, and when you yeah, if when you're joining a company that are growing in our stage, you obviously learn a lot, and you have, there's a lot of there's people that have made a bit of money on sort of their options where they're former employees and they're willing to put it into newer companies to have a functioning ecosystem with angel investors and so on. And there's obviously a lot more attention from international funds as yours, focusing on Stockholm and the Nordics in general. So I think Stockholm is a good place to start a company. I think that any place is a good start, good place to start a company. Now also when the world have learned how to do remote work, I don't think it maybe doesn't matter as much. What do you think? Why is Stockholm? It's still probably like it's the highest amount of unicorns per capita or something like that. So it's
it's as you say, it's we've been doing well per capita relative to other places.
I think one thing also with Stockholm, Sweden in general, is that the home market is fairly small. And now healthcare is an exception, because even healthcare, even in a smaller market in Sweden, it's a really big thing, right? But in most cases, the home market is a fairly small thing. So I think that most companies actually do have a sort of a European or a global agenda when they start. And that could also be beneficial of being in a larger market, because you can actually, you can build a huge company in the UK alone, but in many cases you maybe not, you can't build a huge company in Sweden, so you have to go abroad quicker. And I think that could be a part of it. And then
it's actually, I was going to touch on the same point, in that because if you have big ambitions, you might not be satisfied with the relatively small local market of Sweden, and so that conditions you to think quite big from the get-go, or at least think beyond the borders of Sweden. And so, but by default, you're scaling internationally quite quickly, which can probably instill a sense of bigger thinking already from the get-go. So I think you probably touched on some of the most crucial points that I've also come across when thinking about this, and something that I think some other European hubs also have in common with Sweden, whether it's the Netherlands or say the Baltics as well, where the actual home markets themselves aren't so big. So they think bigger from the very beginning. But you did also say that today you can probably start a business anywhere in Europe, and that's also been our impression. We're seeing companies being started more and more in cities that we didn't have as many companies that we were investors in previously, which is really exciting. And maybe just to wrap up our section, I know we're coming close to time. What are your expectations for the tech scene for Europe more broadly going forward, being the CEO of one of the most successful European startups?
My expectations for the European tech scene in general. Well, I think it's, I do believe it's important that we continue to see big tech companies coming out of Europe, especially in our space, and that it's totally doable, and it's benefits. It's two sides of being in Europe. I think it is complex in many ways, given that you have different markets, different languages, different regulations. But I'm really hoping that we will see more mega companies coming out of Europe, and that will be the case.
That's awesome. That's what we want to hear. So it gets us excited as well. With that, thank you so much, Johannes.